And welcome to week 2, October 18, 9 a.m., MED120 40AX. I am your host, Vanna White, and that's me here 5-6 years ago and 40 pounds lighter. Alrighty. Now, of course, what's due today? Medical Language Lab, all week 1 items, Medical Language Laboratory, both chapter 1 and 2. Also, discussion forum. Now, let's say you had a rough week. You didn't do it. And some of you didn't. Try to do it today so you only get chopped off 10%. Try to do it by tomorrow. You only get chopped off 20%. And those are the late protocols. But do know and understand your future courses, especially if you're in a 200 level course. For me, I remove those protocols. And remember, all of us who work in the medical field, on time is late. There's something called out of post in the hospital. You do not want to get charged with that. If you're late, you're called out of post. That means you're not supposed to be where you're supposed to be, and that's trouble. Now, for whatever reason, this this course skipped chapter 3, and it goes right to chapter 5. So this week 2. And so what's due next week? And what is it? The 25th, next Monday. So 25th, 9 a.m. Medical Language Laboratory for chapter 5, the cardiovascular system. Critical listening exercises 1, 2, and 3. Response exercises 1 and 2. And remember, the practice is extra, but these 2 things are mandatory. Okay. And of course, the discussion forum for this week. What do I want to put? Let's see. The question for us this week is, some of you may know the commission, also known as JCO, or the Joint Commission on the Accreditation of Hospital Organizations. Say that 10 times fast. Well, JCO doesn't like abbreviations. So you will learn abbreviations in this course. Do you believe they are a detriment or a time saver for healthcare communication, which is what this class is? Now, of course, in real life, it's a little bit of both, okay? But for the purposes of our discussion, choose a side, pick a side. And I believe I commented on somebody this morning. It doesn't matter what side you pick. There's no right or wrong. It matters where did you put the proper opinion, which everyone does, and a rationale. There isn't a person yet for this particular course that I saw that your rationale was, crazy. And what's a common rationale that's a little bit nuts? I got into it with politics with my cousins yesterday. They were over for lunch. And it went back to that argument, and they go, so why did you pick this candidate? Oh, but just because. That's not a good rationale. A rationale is because I like this, that, the other thing. But we in healthcare take it a step further. Have evidence. Is there a study? Is there something out there that tells you what you're talking about is actually efficacious or actually works? Right? And my conspiracy theories on COVID and all this other stuff, because what numbers am I supposed to believe? But at least there are numbers. So look up abbreviations, and also you could also look up on why JCO, or the Joint Commission, or also known as the Commission, why they don't like abbreviations. Also, some of you work in healthcare, why you do like abbreviations, and see what the medical community, not only their opinion, but the data on. Is there a lot of errors in abbreviations? Do people misunderstand abbreviations? So that's the point of the discussion. And this week, we're going to start answering each other. And some of you already have started, and you could see my comments. It goes, it's not enough to be like the mutual patting on the back association, which is, hey, I like your comment. That's really great. That's wonderful. Well, if you like someone's comment, say, of course, you agree. That's your opinion and the rationale on why you agree, and that you agree with their rationale. But then find further evidence Well, it goes, oh, I agree with what you're stating about abbreviations. I too don't like it. And it goes, the latest ruling on this, that, the other thing, which I found in an article in 2021's blah, 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 that gives your argument more credibility. And as soon as you get this down at a 100 level undergraduate course, you'll make your life, even in the level of graduate school, much, much better. I was posting for my course late last night, and I found a lot of things like that. Like, hey, Nelson, I really agree with you. Oh, it sounds really cool. And then the whole entire time I'm going, okay, you agree with me, you're patting me on the back, but what evidence can you bring to the table, to the discussion, to make it stronger? This also goes in the face of, when you're having you're having a conversation with people, and yesterday it started forming, politics on both sides of the table. And I had another nephew of mine who's essentially a yes man. Yeah, that's what I'm talking about. And I go, okay, fine, you agree, but it goes, what other data that can back up your cousin? And he was like, no, I just feel that way. Well, the problem with reality and data, it has no room for feelings. And that's why sometimes people in the scientific world, and people especially in healthcare, are seen as cold and calculating, but we're not. We wear our hearts on our sleeves many times, but we don't make decisions without data. So this is a pretty simple and straightforward exercise, but you could see the importance of it when you're moving further on in your career. And definitely when you ask, it's around that time of year where we're going to be asking about bonuses and about budget. The budget should be approved for the university by the beginning of November. So this is around the time where I'm going to start hitting up my boss for how much raise am I going to get this year? And I'm going to get the typical, oh, it's not in the budget, but what am I going to do? I'm going to take the budget, I'm going to find the money, and then I will show her that there is, there's one right here. And this is how I improve performance. And I give actual data. So I might not get the raise that I want, but I think I'm going to get a raise when others won't, because I made the argument, not only made an argument, I have data to support it. And then when you have a good boss like mine who is now, has data, and I could now show her exactly where she can get the money without messing up her budget, what is she going to do? She's going to throw me a couple of percentage points my way. And I've been doing that for 11 years. And every year when people complain in January, oh, I didn't get my pay raise, I just keep my mouth shut. Because one year I got 6% and everyone was told we couldn't get raises. Am I on record? Oh, well, it's a kind of public knowledge already. But it's I giggle about it, but just imagine if I just kept my mouth shut and I didn't present data and I didn't present it in a respectful manner, then I don't get what I want. And all of us are selfish creatures, especially me, because I get what I want. Well, not all the time, but I will do it not only respectfully, but professionally. And that's a way to get it. And when I was a former professor at other places, when you have to do grant writing, that's all you do in grant writing is you're trying to get money off of somebody who doesn't want to give it up to you for a topic that maybe they may not like or may not appreciate. And isn't that the same thing? You have an introduction. You have an opinion. I think you should give me money. I have a rationale. These are the 3 reasons why you should give me money. And then this is the kicker, the data that will support the 3 reasons why you should give me money and how it's beneficial to you. And then I wrap it all up in a conclusion, and I make it short, sweet, and in a formal memo. It just begs to be listened to. Now, let's say, for example, they don't listen to it. Don't you love saying "I told you so" as an adult? I love doing that. It's one of my favorite things. I know. Yes, I'm petty. Right? Then I could always go back to that memo. Oh, do you see how I could have improved A, B, and C for you? But you weren't able to give me the budget. So I wasn't able to prove A, B, and C. And now we're in trouble because of A, B, and C. So next year, can you give me the budget? And then isn't that data now for the next year to give me more money for my budget for the things I need to do? Yep. Yes and yes. So the BA because even though that these some of these discussions, they seem esoteric and it seems like busy work, but if you look beyond it, it's actually developing a skill set. So let me get off my my soapbox because I'm usually on it. Let us now go to chapter 5. So I opened up my textbook and it'll bring us to here, and chapter 5, cardiovascular and lymphatic systems. So we already know cardi is heart. Okay. So what are the objectives? So we have to know everything about heart stuff, cardiovascular, but what's this lymphatic thing? Ich pertaining to lymphat and your lymph tissue and vessels. And when we say vessels, we mean like the tubing. Because what does a vessel do? A vessel transports things, and that's what a tube does. When you have water, it transports or liquid, it transports the liquid or water from one place or another. Hence the term vessel. So you have also lymphatic systems and the cardiovascular system. Your vasculature are also your blood vessels, your arteries, veins, and nerves. Your arteries and veins. And of course, your lymphatic system, which is associated with that. So there's tubing that connects your heart to your whole entire body. And the tubing of your immune system, which is your lymphatic system, is also related to that as well. So those are our two main things. So for example, a cardiovascular surgeon, AR is the suffix, cardio is a root, vasculo is a root. You put them together with a combining vowel, O. So I could ask the question, cardiovascular surgeon, are they good at heart stuff? A. Blood vessels? B. Both or neither. And according to this medical terminology, a cardiovascular surgeon is good at heart and the blood vessels or the tubing that's associated with the heart. And lymphatic systems, of course, immunology would be dealing with it, internal medicine, everyone deals with lymphatic systems and lymph nodes, and we're going to talk about that in a moment. And then we're going to talk about some abbreviations, and of course, not really on the last two parts. Okay, and also there's not a pathology class. We'll touch on the diseases, but we're looking at a lot of the normal stuff. But I'll go over the most common stuff because heart problems or cardiopathology. Cardio, heart, patho, disease, logi, study of. Cardiopathology is kind of important to all of us, especially here in lovely US of A, where we just produce a whole bunch of hypertension and future myocardial infarction patients, or MI patients, also known as a heart attack. So a cardiologist, logi, study of, cardio, heart. They are a subspecialty from the Department of Internal Medicine. So if you see a cardiologist, typically they deal with things medically, but that person already not only went to medical school for like 16 years, that person went 5 years internal medicine and another 4 years for cardiology subspecialty and another 2 to 3 years of fellowship. So that person is, old and went through tons of training. Cardiovascular surgeon. I have a very good friend of mine, Dr. Jesse Garcia. His father was the cardiovascular surgeon for the late George Bush. Is he late? Is he dead? I think he's dead. Right. So they're good at what? Heart and the tubing connected to the heart. So Dr. Garcia, who just finished his fellowship, and we are in our 50s. So you can only imagine all that training just to be not only for surgery, not only for internal medicine, but also a subspecialty of cardiovascular surgery. That's why you will never see a young cardiovascular surgeon or a young neurosurgeon. They're all relatively much older physicians. Cardiothoracic surgery, which is almost the same thing. It's the same thing relatively. Cardio, heart, your thoracic cage, ich, pertaining to your thorax. Your thorax is your chest. So anything that's going on in your chest, which includes your lung. Now, immunology is, again, also a subspecialty of the Department of Internal Medicine. That means that person is an internist, a doctor, and then they do, I think it's 2-3 more years of immunology for that subspecialty. And they're good at what? Immune system, which is your lymphatic system. So when we look at this diagram here, you could see the heart, of course, cardio, and then the vasculature, the tubing, okay? Now, when you look at a textbook and you see a blue tube, that means it's a tube carrying blood that is deoxygenated, meaning to say is the red blood cell is carrying carbon dioxide, or the majority of the red blood cells in this tubing is carrying carbon dioxide. And if you see red tubing, that means the majority of the red blood cells are carrying oxygen. Therefore, this aortic arch here that's going down here into your ascending aorta, right? And most probably going into your renal aorta, right? A renal artery right here. That's all oxygenated, okay? And these tubing is deoxygenated. Now, if you could see here green, it's not colored green in really per se, not even per se. It's not colored green in the human body. Everything in the human body is like 18 shades of brown or gray. So when you see green, think its immune system, its lymph system, and the lymph fluid, which carries a lot of white blood cells, which these other vessels carry red blood cells, but lymph or lymphatic vessels carry lymph fluid, and that also has white blood cells. And the function of the white blood cell is for your immune system, fight off any potential pathogens or things that can get you sick. And of course, you have your interspersed throughout your whole entire body, you have lymph nodes. They act like kind of forward operating bases. If anyone know what that is, any military personnel in the house, a forward operating base is a little mini base that we put that's out in the world. Now, why whoever built me made lymph nodes? Well, it goes all throughout your body. You could have an infection and not even know it, or you can have cancer and not even know it. But then your body knows it, so it'll bring a whole bunch of lymph fluid and white blood cells to the area. Therefore, the lymph node will start getting big, and it will. And if you feel around the body, you could start feeling it. Next time you guys get a sore throat or maybe a toothache, feel around your neck. There's going to be a bump there that wasn't there before. And sometimes if the infection's pretty bad, you can press on it and it kind of hurts. And that is a lymphadenopathy. Let's look at that word. Because you'll see that they'll say cervical chain positive for lymphadenopathies. Lymph. So let me break it down. That there, that there. So, of course, we know what lymph nodes is. So, lymphaden is part of like adeno, which is that's a root, and that will be your lymph gland. Adeno means gland. Now, pathy, of course, with the Y on the end, that's the suffix. And that means, the suffix means process of disease. So if you have a lymphadenopathy, right, you have a sore throat, you feel around your neck or the cervical chain of lymph nodes, cervical, right, pertaining to your neck. And of course, the root is cervix. That means neck. Al is the suffix. And that means pertaining to. It means we're dealing with an adjective, something describing something. So you can't say, oh, he had a cervical. He had a cervical what? Okay, so if you have a cervical lymphadenopathy, that means in my neck somewhere, there are lymph nodes that are swollen up or, swollen up and painful. Okay. So that's how to look at those particular words. So let's jump right in the immunology. Oh, not immunology of root words of the cardiovascular system. Angio, it's blood vessel. Maybe you've heard that slang term before, like, oh, my mom's had to go through an angio today. What's angio? But angio is angiography. That's what you schedule. Why? Think process of. Graph is a recording. So angiography is the thing that you schedule. An angiograph is the actual recording. So, and that's the thing that you go, the test result that you have to go pick up for the physician or the not the technician, but for the physician who's in the diagnostic medicine to go read. And that's most likely either the cardiovascular section of your pathology department or the cardiovascular section of diagnostic medicine, which is usually the Department of Radiology. So angiography, what are we looking at? We're looking at the process of recording blood vessels. And sometimes we give you this, material via your intravenous, via IV, and it'll make, it'll make all the blood vessels pop. So when we do angiography, this is what it looks like. So you can see here all the coronary blood vessels of the heart, and these look pretty good, except for that. Ugh. See that stricture there? Nah, it's a problem. Okay, and then if you have that stricture there, it's going to cause some ischemia or blockage of your blood here. Let's look at that word, ischemia. Make it 26. So when you look at it, the suffix is, of course, ia. It means structure of, or like status of some sort of situation. And isk is your root. Isk is like your this is a difficult way to look at it. Isk is like the root. And actually, the suffix is emia. Right? So some sort of structure or situation of blood, and isk is a root, and that root is blockage. So you saw there on that angiogram, if you have ischemia, it's gonna block that blood getting to that area. And if you have that blood getting blocked, you'll eventually have this situation. And this is kind of a weird word because hypo is the prefix. So it's going to look like something like this. But of course, you had ia before, suffix means situation or status or structure of, hype, which is the prefix, and that means decrease, hype or hypo, and ox for oxygen or oxygenation. And the abbreviation is O2 with like a subscript like this. And we don't want that, because if there's no blood to that particular area, that area will die. And we're going to be talking about a myocardial infarction momentarily. Okay, but this is your typical coronary angiography, and that's what it looks like. And then sometimes we put contrast material. So this thing will start glowing in the dark, and well, not in the dark, but on this film. That's another slang term for an X-ray. It's a film. Aneurysmography, Rafi, process of suturing, and aneurysm. So what's an aneurysm? There's a picture of it in your textbook further down, but I don't want to waste time just getting it. We'll just show it to you this way. If you look at this, you know, like in a garden hose where you have an area of the garden hose that maybe got worn away, and you might expose some of the layers, and then you could see it like bubbling out a little bit. Well, that defect in the arterial wall and arteries are under high pressure, it'll cause a bubbling like that. And when it bursts, that's called an aneurysm. Now, that's bad news if it's here in the brain, especially in this thing called the circle of Willis, which is the main highway of blood vessels in your brain, right? If that happens, say goodnight, you're not going anywhere. Also, if you have it here, like this aortic aneurysm here, right? Abdominal aortic aneurysm, that thing pops, you got about 30, 40 seconds to say goodbye to loved ones, because you're going to go. All you're going to have is some symptoms of dizziness, lightheadedness, and then you are done. Here's another picture. As you can see, the aneurysm, how it out pockets like that. And then since arteries are under high pressure, it'll burst. Or if your patient's hypertensive, it'll burst. My aunt died of an aneurysm a couple of years back. All she did was she said, I got a little bit of a headache. I'm going to go take some aspirin. So she was at work. She went into the bathroom, and then she's a teacher. So when the kids were like, hey, where's the teacher? The kids went looking for her. Thank goodness they didn't open the door, because a co-teacher found her on the floor unresponsive. And that's how she died. And it was an aneurysm. But if we can find it early, we could suture it up and prevent that kind of thing. But aneurysms, that's genetic, and it's like 1 in a million type thing that happens. Aorta stenosis, your aorta, the largest artery in your body, if it's stenotic or has narrowing, and if you recall, osis is the suffix that means abnormal. So a stenosis in your body, a tube that's starting to get narrow and form a stricture, that's a problem. Arterial sclerosis. Now, that is also another abnormal, but it's now abnormal hardening. Now, the thing about fat in your body, if it's chronic or it stays in your body a long time, it starts hardening up, and then you'll have sclerosis. And if you start hardening up your arteries won't be able to respond to stress. And if it doesn't, your blood pressure will go up. It'll do bad things to you. It can get you a stroke. It can get you a heart attack, a whole bunch of other things. So both situations are not good. Aortostenosis, that's narrowing. Arterial sclerosis, that's hardening. And sometimes, especially with fat plaques, it's like this hardening piece of fat in your blood vessels. Both is happening at the same time, which is not a good thing. Arteriolitis, inflammation or infection of your arteries. Now, an arteriole is just an artery that's very, very small. You also have a vein, and if you have a very, very small vein, it's called a venule. So the suffix OLE connotes very small tubing, and the suffix ULE, let's say I put it in the back of this word, vein, VENULE, venule, it means a small, very, very small vein. Atrium and ventricle, those are the rooms of your heart or chambers of your heart. If you look at your heart, there are 4 rooms or 4 chambers. That's not a good here. So you have a left one. Remember, this is the left side of your patient. Let's make this a little bigger. You have a left one, right? The little room on top is called your atrium, and if it's on the left side, and you can see it's oxygenated because it's colored red. Then you have the left ventricle, which is the big room or big chamber on the left side of my patient's heart. And if I have a left, I have a right ventricle, right atrium. You will see the right-sided part of their heart is colored blue because most of the red blood cells in that area are deoxygenated. This side is called your pulmonary circulation, and this side is called your systemic circulation. So it makes sense. The oxygen has to go to the rest of your systems to go feed it. And the pulmonary circulation, this side has to go back to my lungs so I can get some more oxygen. Now, so if I had, I got rid of it. If I had a valve in between my atrium and my ventricles, then that's called an AV valve, also known as your atrioventricular valve. If I have an atheroma, remember that fatty those fatty deposits I just mentioned about. Atheroma is a fatty degeneration, or the walls start getting covered with plaque, and then you can get atherosclerosis and atherostenosis as well. Okay, and tumor to us just means lump or bump. Someone with an atheroma does not have cancer, but there's a lump or bump of a fatty plaque that's starting to accumulate on the patient's arterial wall. And then your patient is going to start becoming symptomatic. They're going to have chest pain due to exertion, and that's called angina, also known as angina pectoris. Maybe you've heard of it. It's like the precursor sign and or symptom for heart attacks. Cardiomegaly. You don't want that heart to grow any bigger than it is as an adult. So the suffix megaly means abnormal enlargement. It can also be called megalocardia. And in this case, you could see how the suffix now became a root, because mega can also be used as a root. Phlebitis, phleb, your combining form is phlebo. Combining form for vein is veno. So you see all the combining forms have what? A root plus a vowel, and 99.9% of the time it is an O. So if you had phlebitis, you have inflammation or infection of your vein. And when we take blood from your arm, that's called phlebotomy. Tomy, the process of cutting phleb into my vein. And if you take a really good look at that needle, maybe if you're like me and you're afraid of needles, I'm okay with giving you a needle. I just don't like getting it. But when I get blood, I always focus on the needle, and sometimes they call it a cutting needle, because if you look at it, that's what it's doing. It's cutting into your arm, and that's that burning sensation you feel right when you when the vein goes into when your needle goes right into vein. Venous, of course, venous blood is typically deoxygenated. The prefix D means no or not. Thrombo, remember thrombocytes? Thrombocytes is a platelet or a blood clot cell. And if I gave my patient a thrombolytic medication that performs thrombolysis, lysis is breakdown, thromb is clots. So that means my patient will bleed out. So that's one of the side effects if I give my patient a thrombolytic medication for their heart problems. And the reason why we give thrombolytics is it thins out the blood, okay? And if what's easier to pump, water or molasses? That's why diabetic patients, we are very, very concerned with the heart and the blood vessels, because you know, if I start putting sugar in water, what does sugar start doing to water? It starts making syrup. And that's not a good consistency or viscosity for blood to be rolling around. Blood should be nice and loose. And that's why maybe you've heard, or maybe you've been given, if you have a heart condition, you've been given, St. John's aspirin, and that's baby aspirin, 81 milligrams daily, just enough to thin out your blood. But it shouldn't be enough to give you all the stomach cramping that a full-blown dose of aspirin would give you. Vasospasms. Remember that, well, why do I say remember? Not all of you had medical anatomy and physiology. Blood vessels are covered in muscles that help, control blood pressure. And sometimes you get a vasospasm. So vaso. Now, vaso also means the tubing in the male testes. So if you have a vasectomy, they're talking about the tubing, the vas deferens. Vascular, pertaining to blood vessels, right? Cardiovascular surgeon, they also are good at blood vessels. And we already talked about ventricles and atrium, right? And the ventricles are the bigger chambers of the heart. So if I had an intraventricular problem, it is a problem within your ventricles, which is not a good thing to happen. Whew. Next, let me get a drink of water. Feeling parched. Thank you. All right. So tachycardia. Cardia, ia, like situation or status of my heart, right? Ia is the suffix, cardi is the root. And if you put it all together, ia is some sort of condition or status, cardi is your heart, and this prefix tachy means fast. So fast rate. So let's look at different types of cardia. I could have tachycardia, right? Which is, and tachy is the prefix. That means fast. So typically heart rate is anywhere from 60 to 100 beats per minute. So greater than 100 beats per minute, my patient has tachycardia, whether they're nervous, they're on cocaine, or they have a cardiopathology. Tachy is fast. Now what's slow? Bradycardia. Exact opposite. And what's normal? Eucardia. EU is the prefix. The prefix is normal. Normal is norm, al, pertaining to the rule. And the rule is you should be from 60 to 100. You should be eucardic or normal cardiac. Who's calling me? Don't they know I teach at this time? Maybe not. Okay, let's look at this ECG. Electrocardiogram, electrocardiograph, electrocardiography. Doesn't this look like a beautiful A, B, C, D, all of the above, E, none of the above question? The electrocardiogram, if you look at the suffix, gram is the actual recording, okay? Graph is the actual instrument. Graphy is the actual process. And let's take it a step further. Grapher is the actual technician. So gram, electrical recording, the graph is the actual instrument, and the graphy is the process. This is what you schedule. Goes, this is what you maintain, the instrument, and this is what you grab, the actual paper that, or the file. Nowadays, it's a file that you give to your doctor. Okay, and grapher, if you're the one who did the ECG, then you're the technician or the electrocardiographer. Now, you'll see it as abbreviated ECG or EKG. And I think I mentioned it last lecture that EKG, the K is because the Germans are the ones who invented the ECG or EKG. They're the ones who invented this machine and the theory of it. Some cat named Einthoven, kind of like a combo between the word, the name Einstein and Beethoven, therefore Einthoven. He figured out that all the heart is of course is a muscle. A muscle has to respond to electricity, and if the electricity looks right, that means my patient should be okay. If the electricity isn't good, that means my patient has some problems. Arterial stenosis, osis, abnormal condition. We already know what stenosis is. It's narrowing or stricture, and it could happen in my arteries. And if it happens in my arteries, that is not good for my blood pressure. Think of it this way. You have a hose, right? What happens when I start squeezing on that hose? Will the water get to the other side? Or would the blood get to where it's going? It won't. Then we're going to have a problem. And it'll also increase blood pressure as well, which is never a good thing. Endocardium. Let's look at that word and how it could pertain to your either current or future anatomy and physiology needs. So let's look at the pericardium, myocardium, endocardium. Now for all of them, of course, is the suffix. It means structure of. Cardi, we already know, that's the root. That means heart. Now, if we look at all these prefixes, peri means surrounding. So it has to be the one on the very outside. Myo has to be muscular, muscle, right? So muscles are usually where? In the middle. M, middle. M, muscle. And endo, within. So if you look at pericardium, myocardium, and endocardium, the pericardium has to be the structures that will cover the heart or surrounding the heart. Great, I spelled muscle wrong. Myo is the middle section of the heart, and that's where the muscle is. And endo is all the structures that are within the heart. So my patient can have pericarditis, myocarditis, endocarditis. But endocardium pathologies, those are the most dangerous out of these three levels because it's inside, it's not good. Right? It's a way to look at and different prefixes, and also the way to look at how you're going to do stuff like this, anatomy and physiology. Again, you're not responsible for these pictures, but I just like pointing them out. They're nice if you're taking anatomy and physiology. And they have these little quizzes that you can take over and over and over again. I skipped something. Oh, here you go. Red blood cells, white blood cells. Now, red blood cells is typically abbreviated all lowercase. All capital RBC means red blood count in the real world. I don't know who wrote this, but red blood cells is lowercase abbreviation or acronym RBC. Red blood count is uppercase. Now, red blood cells are also known as erythrocytes. Let's write that down. Where's my Microsoft? So WBC, all lowercase, white blood cell. And those are called leukocytes. Cyte is the suffix, leuc is the root, so it literally means white cell. Okay. Now, RBC, all lowercase, is red blood cell. And that's your erythrocyte. Cyte meaning is your suffix meaning cell. Erythro means red. So if my patient has erythema, that means what color are they? Like they're red, they're flush. And of course, platelets, you already know what do platelets do. And the blood clot cell, that's a thrombocyte. Cell that clots. Okay. Also, though, in slang, they'll call it plates. Now, capital WBC is white blood count from your CBC, which is your complete blood count. RBC is, of course, your red blood count. Also part of your CBC, which is your complete blood count. We'll learn that later. Okay. Red blood cells, they carry things, oxygen, carbon dioxide. White blood cells, they are your white knights. They're the ones who are going to fight infection. And last but not least, thrombocytes, also known as platelets, will clot things. And these are the three main things that travel in your blood vessels. Oh, here you go. Out here. And of course, oxygen is written this way. Low oxygen, deoxygenated, that means little to no oxygen. Another for state or situation, state or condition of low oxygen is hypoxia, and we already went over that as well. Next, atrium, ventricle. Oh, here's a nice picture. We already know that this little room is an atrium. This little room is an atrium. This big room right here, that's a ventricle. This big room right here is a ventricle. So see this parachute type valve that's here? That's got to be your AV valve. And if it's on the right side of your heart, that's your tricuspid. And if it's on the left side of your heart, that is your bicuspid, also known as your mitral valve. You learn all of that when you are in anatomy and physiology. And if you took anatomy and physiology and you don't remember it, start looking. Atrial flutter, atrial fibrillation, flutter and fibrillation. Yeah, this is not an EKG class, but just know that your heart beats in a coordinated fashion. And when it starts to like this and then go totally out of whack, that's since I mentioned it, let's go look at it. Remember we said about EKG can tell me a lot about my patient? Well, here. This is not normal. You see this, how all those lines here are all scraggly and all like don't make any sense? That's AFib. That means your atria is not doing its job. It has uncoordinated contractions. And the precursor to AFib is aflutter. You see how it's like versus, see how it's like a sawtooth pattern? That too is also abnormal. It's supposed to look like normal. That's not normal. That's not normal. That's not. Don't they have NSR? This is what your heart's supposed to look like. See? You have a beautiful P wave, QRS, and a T wave. But when you have flutter, it starts having a sawtooth pattern. And fibrillation, this line gets all scraggly, if that's a word. Looks like looks like my 2-year-old draw it if this baseline goes bad. Of course, known as your ECG or EKG, either one. Septum, structure of. Sept is something that separates right and left. And your heart has this big, let's go back to the picture of the heart, has this big intraventricular septum. It's in between or intra your ventricles. Here's one ventricle, here's another one, and here's the septum that separates the right from the left. And maybe you've heard of VSD, ventral septal defect. That means there's a hole in between here, mixing the oxygenated with the deoxygenated blood. And that's not a good thing. I had a nephew who had it. Or was it my niece? I don't know. I barely know their names, so asking a lot of me. Rapid breathing, rapid eating. You could also have tachy for breathing, tachypnea, slow breathing, bradypnea. You could also have tachyphasia, which is too much eating. You could also have polyphagia, which I'm really good at. That's another way of saying too much eating. But tachy means fast. Okay, so if you have a person with a neurotic state or nervous, they want to eat fast, it's tachyphasia. Let's see, what else looks good? Oh, lith is the suffix that means stone. A calculus, structure of rock or something that's hard. So an arterial lith is a stone in your arteries. Stone in your arteries. No, we went over that. Hemat is blood. So the study of blood has to be hematology. The specialist at the study of blood is a hematologist. Okay. Don't you think I could have this question? Is it A, B, both, neither? Which of the following is the department that you would call? Would you call A? Right? Sometimes it goes, no, I don't want to tell you. That's right. It'll take too long. Just know there's a difference between hematology and hematologist. Logi is the study of, department of. Logist is the practitioner or the specialist. Angio, we already talked about. Hemo, we already talked about. Yeah, it's not a common word. Hemojectis is pertaining to the lungs. Remember pertaining to? ARI, AR, AC, IC. On my notes that I put in the announcements, I gave a whole list of adjectives pertaining to. So you don't say someone had a pulmonary. They had a pulmonary what? That's like saying, hey, can you sit on this blue? Sit on this blue what? Vascular. My patient had a vascular pathology. My patient had a cardiac pathology. I hear a lot in the hospital. Well, when I was in the hospital, oh, he had a cardiac, and I would say to that person, cardiac what? What are you talking about? And he goes, oh, he had an MI. And I go, then say MI. What the heck does cardiac mean? Ol and Ul or Yule, Christmas is coming, right? Means very, very small. So I could have an arteriole, means a very small artery, and a venule, which is a very small vein. Hardening arteries, we got that. Superior vena cava, inferior vena cava, nice to know. Oh, varicose veins. Now, veins are under low pressure, and the blood should only go one way. But veins have these valves that when you get older, they start to fail, especially if you're a person who, has a job where you're standing around a lot. And that's where you get these things, varicosities or varicose veins. Okie dokie. Here's another picture of nice AV valves, your atria here and here. Atrium is singular, atria, plural. Ventricle, ventricle, ventricles, plural. And this is on the right side. So this has got to be your pulmonary semilunar valve because it's going to my lungs. And here is your aortic semilunar valve because it's going to this big thing here, which is your aorta. What else? I don't need to know SAAV node yet. You don't need to know this stuff yet, unless you want to be an EKG technician or take my EKG class. Electrocardiography we went over. Now, curious, nope. Oh, you could see how you keep on drinking beer and eating Doritos, such as my lifestyle. Well, my previous lifestyle. Don't anymore. It was really difficult. I was doing a gig the other night in Chantilly, and they had really good bar food. But if I eat that stuff, it's high in salt, high in fat. What will it do? They'll form these fat plaques here, and then it'll make the lumen or the hole stenotic. Now, the fat, especially when exposed to a lot of salt and over time, will start hardening, and then it'll form sclerosis. So think stenosis, narrowing or stricture, sclerosis, think, hard C sound, hard K sound, sclerosis. That's what? Hardening. And if I have a hardening of an artery, or if I have blockage that will give my left ventricle here some ischemia, that blockage there is called a myocardial infarction, also known as an MI. Let's break down the word myo. Suffix is al, pertaining to. The prefix is myo, meaning muscle. And of course, the root is cardi, meaning, of course, heart. So it's pertaining to the muscle of my heart is being infarcted. And infarction is a blockage. And if I have blockage in that local area, I'm now going to get ischemia. That's a state or condition of blockage of blood. Blood has oxygen in it. If I block it, that area will be messed up. Most common, and they're showing you the blockage right here, is your left anterior descending artery, and it's a coronary artery, which is one of the many arteries and veins that surround your heart, and it supplies the heart muscle with oxygen and other nutrients. You block that, this will start to die, and that's when you get a heart attack. And it could be acute. That's why you might see something called an AMI. If I have an AMI, that's acute, meaning it just happened right now, versus the word chronic, pertaining to time or pertaining to over some time. So if you have a chronic cardiac condition that you've been had that condition for months to years or even decades. But if you had something acute condition like a AMI or acute myocardial infarction, you just had that it just happened overnight. So something acute condition happens overnight. Chronic took months to years. Now, acute conditions, we in the medical field like them better because they're easier to repair. A chronic condition, it's, to be brutally honest, it's not much I could do. That's why internal medicine is more about prevention and preventive care, because once this stuff starts happening, it's hard to go back. Necro. Now, if the hypoxemia continues, I'm going to have necrosis or osis, abnormal Necker cell death. So I have to perform necrectomies. I have to remove the necrotic tissue, or that dead tissue is going to signal the live tissue to go die, which is not a good thing. Necrophobia, of course, a person's fear of death. And remember, fears are, remember we told about the word rationale? There's got to be a reason, right? And when you look at the word irrational, there is no reason, okay? So a true phobia, like you're fearful, like if you're fearing death with someone pointing a weapon at your head, that's normal. You should feel, distress. But if you fear death, let's say you have a neuroses or a neurotic condition where you're very, very nervous. If you fear death all the time to the point you don't want to go outside, that's a true phobia. That's what we really mean by phobia in the psychiatric realm. It's irrational, and it comes by it. These fears come to these people and debilitate them to the point where they won't, they can't function in society. For example, I may say I have a fear of heights, right? Acrophobia, right? But I don't really have I got a problem with being in a building like really high, but I'll feel nervous, but I won't really not go up, go up there. And also, if you have a true phobia and you deal with it psychiatric wise, that's just in the same way as dealing with any other deficiency. Always attack your deficiencies. That's why I got a fear of heights. But if you look at my car and look at my uniform back in the 1980s, you'll see a beautiful set of jump wings. I jumped out of perfectly good airplanes in my youth, just to prove something to myself, that fears and that nervousness and that can always be overcome, which is kind of neat. I got a coupon for it, but my wife won't let me do it. She's like, oh, what if you die or break all your bones? And I'm like, you got a point there. I was 17, 18 years old when I went to jump school. 2 dudes in my chalk died. And that's training. So that's something. Necrosis, abnormal condition of death. So I guess that's what my wife is fearing, an abnormal condition, dying before my time. And there is a time. All your cells are programmed to die. You can't live forever. Here's a plaque. Now, if a piece of this fatty plaque breaks off, that's called an embolus. Let's look at that word. And multiple pieces that break off, that's emboli. So that's plural. And embolus is singular. We're afraid of that. And that's why any clots or any pieces of a fatty plaque, it's why the protocol of, if any of you who had a child recently or in the past, That's why, like, right after your stitches are brand new, you're all packed up. That's why we make you walk around. It's not pleasant, but I'm doing it to prevent that clot from going someplace that's bad, like your brain or your heart. So you got to walk it off. MI, we already know that. Thrombo, we already know that. Thrombosis, anticoagulant or a thrombolytic. It's and if I have a single thrombus, I have many thrombi. Okay. Genesis means to produce. So pathogenesis is to produce a disease, and to produce a blood clot, that's thrombogenesis. Thromb means blood clot. Okay. But if I take an anticoagulant and or a thrombolytic, it is going to prevent that clot. Okay. Lysis means breakdown. So thrombolytic or thrombolysis. Okay. Thrombectomy, I am performing a procedure, right? Why? Process, performance of. Ectomy, what do I do with our X? What do I do with our X's? We cut them out. We surgically remove them out of our life. So I am surgically removing what? That blood clot. Yeah, that's funny, blood clot. All right. Those of you from the islands may have got that joke. Now, let's look at lymphatic stuff or stuff that's in the Department of Immunology. So adeno means gland, but they're not really glands per se, but they kind of look like them. So that's why you even see the term adenoid. Oid means resembling or looks like something. And so if I had adenopathies or lymphadenopathies, that means it's signaling me that there's a disease state nearby. Agglutination or clumping. The best way to remember that is to remember what happens when you have antibodies and they come in with antigen. What will the blood cells do? They'll start clumping up like this. And that's called agglutination. That means there is an immune process going on. So for example, if you have anti-B antibodies, right? And then I put that anti-B with B blood, you're gonna have clumping or agglutination. Immunogen, that's anything that will generate or create immune. So not only should you be getting the vaccine, not only should you be wearing your protective personal equipment or your masking up, you should also be working out, trying to get a lot of sleep. There is a direct correlation between sleep and weight loss. For people who sleep irregularly, that's us in the healthcare field, and for people who sleep less than 4 hours, that's also us in the healthcare field. It's a considerable amount of weight gain. And I just read a paper, I believe it was NIH, can't quote me on that, even though I'm on recording. 2019, 2020 statistics state that currently, well, not currently, back then, at least when the study was done, typical Americans are around 39% of Americans are at least class 1 obese, which is, is just right on the cusp of being obese and having problems. But nurses in America, from when I read that article, are up to 47% because of the things that I outlined. And there's a lot of training now in the healthcare field that promotes these other immunogens other than, just getting your shot, wearing your PPE. We're always now talking about work-life balance. I haven't had a vacation in years and it's showing. Is it any surprise I gained 50 pounds in the last year? I guess, is it any surprise I'm stressed out? Is it any surprise, I don't get to the gym often, or I'm irritable, I'm this, I'm that? Nope. and that's data. So trying to get more sleep, trying to trying to drop more weight, and all of it's connected, and they're immunogens. I've been sick since the pandemic, been swabbed 3 times, been sick like 6 times, but I don't have the COVID. Why? Is it because I'm lucky? No, that's not how it works. I guess because I have other immunogens in play other than, of course, I got vaccinated, especially the first time. The first time I thought I had pneumonia. That was over a year ago. Man, that was scary. Lymphopoiesis. You could also have hematopoiesis, formation or production of your lymph vessels. Or if it's hematopoiesis, like what goes on in your bones, that could be formation or production of hemat or blood. Lymph gland, lymphadenitis, we already talked about that. Lymph vessels, lymphangioma, angie, right? Blood vessels, lymph, of course, the lymph vessels or lymph tissue. And oma just means tumor. This suffix just means it's a lump or bump. It doesn't mean my patient has cancer. But if I write the medical term lymphangiocarcinoma, then my patient definitely has cancer. But lymphangioma, there's a tumor, there's a lump or bump, I want to go investigate it. Phagocyte is a cell that eats. It's actually a white blood cell. And what do white blood cells do to bad things? It eats things, hence the term cyte. And phago or phagio could also mean eating. So if I have dysphagia, I am having abnormal eating or swallowing. If I have polyphagia, I could be eating too much, like in the case of a diabetic. Many diabetics have polyphagia, and you'll learn there's a reason why. It's not because they have poor willpower or it's, what's the argument? It's just genetic. I'm just big boned. No such thing. And weight, if we as Americans start seeing as weight as a healthcare indicator versus like a clout thing versus a fashion thing, right? Or what size are you? Who the heck cares about what size or what I look like? I care about how is that size affecting my health. Okay. Like even I've been getting back to the gym and doing stuff. So yesterday I was on a morning hike with one of my young babies, and he fell asleep. So I had to carry him through the woods, 45-pound little sack of meat for 3 miles. I didn't realize how deep in the woods we went into. I'm exaggerating. It was like around 2.2. That's a better, I was around the 2.2, 2.3 mile marker. And I was thinking, oh my Lord, I am now. But you know what? If I don't keep myself healthy, I wouldn't have been able to get out there in one thing. And I have a lot of friends, and we're only in our early 50s, who can't do that. I have a lot of friends who can't climb up stairs, and that's a sad state of affairs. If you climb up a set of stairs and you feel dizzy, go see your physician. There's something up, and it's not a good thing to be. Thymoma, of course, it's a tumor. It's a lump or bump. Where? In my thymus gland. Okay, and typically it's benign. Anaphylaxis. That is an extreme allergic reaction, meaning to say is it is an emergency situation. Everything is going to start closing up because phylaxis means protection and ana means parts. So if you have analysis, it means to break down into parts. So anaphylaxis will start affecting all parts. So you're going to have like swelling everywhere. Your throat's going to close up. Your lungs are going to close up. That is a very dangerous thing. And if you're a person who has severe allergies or can get severe allergies, always have your EpiPen in your bag or in your purse. I have a big time allergic reaction to shellfish. I always tell this story when I talk about anaphylaxis. When drug reps back in the day used to take us out for dinner, that's actually against the law nowadays. Well, the drug rep brought us out for dinner and drinks, and of course it was free, and it was I think it was at Legal Seafood or something like that. And there was a whole bunch of like prawns and shellfish, and of course I haven't eaten, so I start loading up. The nurse next to me tells me, Dr. Garais, oh my God, your eye's swelling. And I'm like, it's no big deal. I'll just take some, I'll just take some Benadryl when I get back to the ward. Well, long story short, I didn't make it back to the ward. Well, I did. I made it back to the ER where my colleagues cut up my clothes and saw me naked. That's not fun, right? Because I went into anaphylactic shock because my throat started closing up. I couldn't see, I couldn't breathe, and all these bad things. And that nurse, bless her soul, she saw it coming, and she got an EpiPen and stuck me with the EpiPen, which I didn't remember because I was too busy not being able to breathe. They almost had to intubate me, which was horrific. Ugh, if anyone has ever been intubated or had a tube put down their throat, is not pleasant. If you see this picture, you'll know that these are lymph nodes because they're colored green. And there's these little nodes, and these are, of course, lymph vessels. Okay. And wherever there's an artery and a vein, you also have lymph vessels as well, because they not only bring immunogens or white blood cells to the area, they also pick up any extra fluid that an arterial or a venule might have. And this is, of course, capillaries, which is the connection between arterioles and venules, where there is gas exchange, also fluid exchange as well. That's why you see all of this lymph vessels. Man, who's calling? Still lecturing. What's up? Okay. Lymphedema. That's when the lymph fluid gets backed up. It doesn't do its job, empty out the fluid, and then you get this puffy leg. And that's not good, because if you get it in your entire body, and that's called anasarca, you could have congestion. You can have cardiovascular congestion, which is not good, and then pulmonary edema, which is not good. Those two situations you can easily die from. Okay, let's look at these abbreviations for a second. Right? Okay. I'm just. Okay. So angiotensin converting enzymes, or ACE inhibitors, that's common. AED, automated external or electric defibrillator. Remember the fibrillations we talk about? That's the thing that's going to zap you. Maybe you've seen it. You know, on TV and stuff. Right? You put one there. This is kind of an old one. The new ones have these pads, and then it's like this, and it tells you exactly where to put them on. The key thing is when you press the red button, do not touch the patient. That's when they're going to zap your patient with electricity. And that's an AED, see? Hence the lightning bolt here. You put one up here, you're going to put down here. This represents the base of the heart and apex. And then they have directions. And also, the more modern AEDs, they talk to you. Like, place sticker number 1 on this part of the chest, and it'll show you. It's kind of neat. AICD, that's automated implantable cardioverter defibrillator. That's when we put it internally in your chest. AIDS, acquired immune deficiency syndrome. That's very important to the Department of Immunology. If your patient is HIV positive or has full-blown AIDS, that's of concern. That's of concern to anybody, because it complicates whatever other problem that the patient may have. Bone marrow transplant, BMT. We do that especially if we're trying to find donors for our patient. BP, blood pressure, can also be written lowercase. CA, carcinoma or cancer. Yes, I've never seen it for chronological age or cardiac arrest. CABG, coronary artery bypass graft. Remember we talked about the coronary artery, sometimes it gets blocked and like myocardial infarction. Well, when it's really, really bad, we take some veins from the back of your leg, and then we just bypass the bad parts so that the good parts can start supplying blood to the hypoxia areas or hypoxemic areas of the heart. CAD, coronary artery disease. We already showed you that with the blockage, what happens to coronary arteries if you drink way too much beer and eat too much Doritos. CC, I've never seen it for cardiac catheterization, but it's for chief complaint. When you're taking a history, you need to know the real reason why your patient came there. And that's your CC or your chief complaint. Complete heart block, sometimes you see it, but this CHF, which is congestive heart failure, also known as right-sided heart failure, also known as cor pulmonale. Congestive heart failure is when there's a failure for your heart to pump on the right side, and it's probably due to some sort of pulmonary problem or lung problem. So if you have a really bad lung problem, remember, we learn all of these systems separately, but in real life, they're all connected together. Cytotoxic T lymphocytes, and we don't call them CTLs. They're called CD8s. That's the abbreviation for it. And the T helper cells are CD4. You'll learn that in I don't know, your pathology class, I guess. CV, cardiovascular. Yeah, sometimes we use it. CVA, cerebrovascular accident. I never seen it for costovertebral angle, but cerebrovascular accident is a stroke. It happened where? Cerebro, in your vein. Cerebro, in your brain. And vasculature, in your artery, somewhere in your brain, it got blocked. Sometimes they call it CVA or a stroke, a brain attack. Please look up the 5 cardinal signs and symptoms, or the 4 main signs and symptoms. It's called FAST for recognition. When my wife wasn't a medical professional, she remembered me telling her once about FAST, and that time she saved her father from a stroke because I wasn't home, because I was working. Deep vein thrombosis, abnormal condition, right? DV of your veins to form clots. That's why when mommy, right after you have delivery, that's why I have to, after we put the Pampers on you and put the ice and you're feeling a little bit of comfort, that's when I give you the bad news. Mommy, we got to stand up. We got to walk around. And I know it's unpleasant, and it's painful. You just got cut up minutes prior, but I'm doing it to prevent DVT. Epstein-Barr virus, EBV, common, but it's not typically linked to anything pathological, but it is, but usually with immunocompromised patients. ECG, EKG, we already went over. ELISA, enzyme-linked immunoabsorbent assay. It's to detect antibodies, right? And we could use it for HIV. We actually, some form of it we use on pregnancy tests. Some form of it we also use on the tests for COVID. Heart failure, HIV, of course, that's important. Now, hypertension. See, textbooks call it HTN, but in the real world, it's lowercase HPN. I see it sometimes like that, but I see it 99% more, well, in my experience. IAS, ICD, nice to know. Inferior vena cava, superior vena cava, nice to know. Left atrium, that's good. Oh, LDL and HDL. LDL is low density lipoprotein. HDL is high density lipoprotein. VLDL is very low density lipoprotein. So what does it mean? Lipo means fat. Protein is a bunch of amino acids glued together. Now, what are these things? LDL and VLDL are simply, the best way to put it is like a storage truck that moves cholesterol into your body. And HDL, which is high density lipoprotein, is kind of like a vessel or a truck that brings cholesterol and fat out of your body. And that's why LDLs and VLDLs are called the good cholesterol. Erase that. LDLs and VLDLs are called the bad cholesterol, and HDLs are called the good cholesterol. All right, there's not good or bad. One doesn't wear a black hat and tie people onto a railroad track. It's just that if you have a lot of LDLs and VLDLs like me, it's not a good prognosis for heart care. But if you have a lot of HDLs right? If you eat good fiber and take care of your diet, okay, then you have a lot of transport of cholesterol out of your body. MVP, mitral valve prolapse, yeah, we see it. MI, myocardial infarction, very common. AMI, acute myocardial infarction, very common, also known as a heart attack. RBC, we went over. WBC, we went over. SAAV nodes, not so common, but you'll learn that whenever you get your EKG training. Oh, I just noticed there's only 5 of you. We lost somebody. That's all right. SLE. Where am I? Systemic lupus erythematosus. I've never seen it for slit lamp examination for ophthalmology, but SLE is very common for this autoimmune disease that usually affects women in their 40s or their midlife, and it's systemic. That means you're going to have signs and symptoms all over the place on all systems. Erythematosis. It's like osis, abnormal condition or structure of erythema. SLE has this very common, it's called a malar rash, and it's on your face. See, it's called the butterfly rash, also known as your malar rash. So it looks like a butterfly on your face like this. I think that's a drawing. It's something exaggerated. Here's like in a real person. And male patients can get it as well. Here's another person, see? And that's called, but that's the least of their problems. They have a whole bunch of systemic problems. They're gonna have lung problems, kidney problems, a whole bunch of TIA, transient ischemic attack. And remember, CVA is a stroke. Well, a TIA is known as a baby stroke. It's transient, means it comes and goes. And it has the same symptomology as a stroke, but it comes and goes. And then you go to the doctor, they're not going to find anything really. Usually the patient's pretty much asymptomatic after that. They may have high blood pressure. They may be overweight, but it's not a requirement. But here's the horrible data on it. TIA, once diagnosed, if you don't do anything about it, you're going to have a full-blown stroke within 5 years. And a full-blown CVA, that will be on the more devastating side. So TIA is a wake-up call, right? And MI is a wake-up call, which, by the way, I'm not too worried about the heart attack. I'm worried about the congestive heart failure or the chronic heart failure or the heart failure that will ensue. That's the thing that's going to kill my patient, not the stroke, the ischemia that'll follow. US is ultrasound or ultrasonography, and we already went over WBC. I mentioned angina pectoris. It's all these different types of pains. It is a precursor for impending myocardial infarction. It's when you get chest pain due to exertion. And if you get chest pain without doing anything that requires exertion, that's a problem. You got to go see a cardiologist. So that's never a good thing. We already went over DVD or deep venous thrombosis. Brewery. Brewery is turbulent blood flow. Blood flow should be smooth. So right now, for all of you who don't have any cardiovascular insufficiency, if I put my hand on my neck and feel it, you may feel maybe your pulse. But other than that, you shouldn't feel a rumbling. If you feel a rumbling, that's cardiovascular insufficiency, and that rumbling is called brewery. Embolus, we already talked over. Heart block, nice, no need to know. Heart failure or congestive heart failure, very important, right? That's bad news. Hypertension, increase of blood pressure greater than 119/79. 120, does 120 to 130 now used to be called borderline hypertension. Now, according to the American Heart Association, it is now class 1. And that's like, I don't know, 70% of Americans. Ischemia, mitral valve prolapse. Nice to know. Mitral valve, of course, is your atrioventricular valve, also known as your AV valve on the left side of your heart. And if it prolapses or like fails, that's a problem. Patent ductus arteriosus, or PDA. There's a connection here between your pulmonary artery, which is right here, and your aorta. There's a hole here. But when you're born, that hole closes up. If it doesn't close up, you get PDA, and that's not good. Raynaud's, nice to know. Rheumatic heart disease, nice to know. AIDS, definitely need to know. Lymphoma, KS. Kaposi sarcoma, must know. KS is not closely associated with AIDS. It signals it, right? If you see Kaposi sarcoma anywhere on my patient's body, the first thing I'm going to check is HIV status. If they're HIV positive, they are now going through the threshold of having full-blown AIDS. Mononucleosis caused by the Epstein-Barr virus. Nice to know, mono. I remember when we were a kid, they called it a kissing disease, right? But it's no big deal. SLE, another malar rash here. Enzyme studies, they are, when your muscle breaks down, the breakdown of muscle requires enzymes. When those enzymes start upticking, usually around 12, 24, and 72 hours after you start feeling that chest pain. Oh, by the way, a lot of people get silent MIs or silent AMIs. People who are at risk or who have full-blown uncontrolled diabetics have silent MIs. Last year, I diagnosed one of my students. We were in our EKG class, and they take their EKG. It's behind the screen, and then of course the student playing the technician hands me the paper. I look at the paper and I see inverted T waves, and I go, "Hey, how you feeling?" She goes, "I'm okay, bit under the weather." And I go, "Okay, can you put on your shirt and get all your stuff? Do you have someone to drive you to the hospital?" And then she started going, "Why?" And it goes, "I want you to bring this to the doctor and tell them I'll put the name, date, and time to it, and they could call me." Right? They called me from the emergency room. My student was having a heart attack. She was only 31, no kids, and she wasn't maybe obese class 1 at best. She wasn't entirely unhealthy, but oh my goodness. It goes, she was having a heart attack. And the class that remained, right? Of course, I can't discuss it. They were like, "Dr. Garais, why are you sending her away?" And I go, "No, it's none of your business. Go away, go away." But then I got permission from the student when she came back a couple of weeks later. And then we all shared with the class and how silent MIs are very dangerous. And when she was at the hospital, they took her blood sugar. And because I asked her, "Are you diabetic?" She goes, "I don't think so, but my mom and dad are." And then I'm like, it all screams something. Panel. When you have a test that says panel, it means everything. So the lipid panel would be like every blood test that has to do with fat. And that's what lipid is. Oh, one of those enzymes that we talked about for damaged heart muscle and skeletal muscle, that's troponin. There you go. So if you got troponin, the other one is, oh my God, I forgot my enzymes. Let's not talk about the ones I forgot, shall we? Here's the ultrasound. Like if my patient has some bruit, I'm going to go inspect the area of bruit, and I'm going to use a Doppler US, or also known as the ultrasound, same thing. Now let's look at this word biopsy. Let's look at the word opsy since they mentioned it. Now, this is one of those weird words where bi, which actually means bio in this case, and that is the root, and that means life. So biology is what? Study of life. Now, opsy is the suffix, and that is the ending that means the process, remember that Y, of visual inspection. So when we send the biopsy to the Department of Pathology, it is actually a piece of someone's life. I took a piece of your life and I gave it to the Department of Pathology so they can look in a microscope, right, to actually visually inspect, hey, is that actually cancer or not? So even though I found the tumor, that's just a lump or bump. But when that thing comes back, and we have it, what, carcinoma? Then my patient definitely has cancer. So it's definitive. A biopsy is a definitive test, okay? And performed by the Department of Pathology. Now, what's another opsy? Autopsy. Aut or auto is the root, and it means self. Opsy, of course, is subsequent. So it's the process of visually inspecting for yourself. So the pathologist has to see or visually inspect the root cause of death. That's why we make the joke. Department of Pathology knows everything, but they know everything too late. Department of Internal Medicine does everything, but knows everything but does nothing. The Department of Surgery does everything but knows nothing. It's an old joke. It's not meant to really be funny. But you could see how when you know your medical terms, then you can then explain to your patient, hey, it goes, I know you saw the word tumor. Let's not be excited yet. Okay? There's a bump there. It could mean everything, it could mean nothing. But then because we're going to biopsy, and then when it comes back, because then we could entertain things. Okay? ELISA, or enzyme-linked immunosorbent assay. Nice to know. Angioplasty. Plasty is the surgical procedure of repair. And what am I doing with angioplasty? I'm repairing that blood vessel. And one way we could do it is roto-rooter. We go in there and remove all that stuff, and then we put this balloon, and it pushes all the garbage to the side, and then it keeps a nice open and patent airway. Not airway. Blood vessel. And that little balloon that left that little mesh is called a stent. My mentor, Dr. Francis Kagiwa, was the direct student of the guy who invented this, Dr. Rashkind. They're both geniuses. I met them both. They're crazy, crazy smart. That's an AFib. We were talking about that. See, that's all ratchety, right? It isn't nice and organized like this. And this is ECG. Now, oops, this is not ECG. This is defibrillator. This is when I want to cardiovert my patient. So my patient's going into fib. We don't like it, right? It's not a good situation to have. They're most likely symptomatic. So I put the pads down in the place where they showed me. I press, there's going to be a red button, and the doctor or the tech is going to stand away from the body until the machine tells them it's safe to go touch the body. Man, when I was in EMS, we used to zap each other for fun. Yeah, we weren't too bright when we were young. We used to zap each other for fun, and it's scary. It hurts, and it makes your heart do crazy things. So don't play around with that machine. Oh, remember that AICD? My father, bless his soul, when he was alive, had one of these bad boys installed, and it'll defibrillate and cardiovert automatically. And it also acts as also a pacemaker as well. Sclerotherapy, that's straightforward. Anticoagulants. Oh, you could have anti-arrhythmatic medication. So if you have a dysrhythmia or an arrhythmia, your heart is beating funny, we give you these to straighten it out. Antihypertensives like beta blockers, very, very low dose beta blockers are really good. Less than 10 milligrams, or was it 10 to 20? Are pretty good. Diuretic. That's a water pill. So what does it do? It blocks sodium. So in your kidneys. So then the sodium goes out into the toilet, and wherever sodium goes, water goes. So you start peeing every 15, 20 minutes. Statins, they lower cholesterol. Oh, I hate statins. They have so many side effects. You know what's better? Just not eating garbage. It's actually better than having the side effects that statins have, and you can look them up. Thrombolytic, we went over. Antiviral, of course. You could have the AZT cocktail, keep you alive forever if you're HIV positive. I got a couple of cousins who had HIV for the last 20 some odd years, and they're healthier than I am. Immunosuppressants. Sometimes we want to suppress your immune system, like for organ transplantation, but we do it in the form of corticosteroids. So it's a double-edged sword, corticosteroids and immunosuppressants. On one hand, it prevents any undue inflammation or anaphylaxis, and on the other hand, it's lowering your immune system. So with that said, because we're done, but I just want you to, for now, and we're going to go over this in week 5, take a look at these like little histories and these case studies at the end. They even tell you what words to focus on, right? And also can give you some questions, because in the future, we're going to be looking at this around week 5. We're going to be looking at all the cases. But for now, what do you need to do before next week, which is the 25th, 9 a.m.? You need to do your medical language laboratory exercises for chapter 5, the quiz, and your, what do you call that? And your discussion. And oh, by the way, if I scored a 0 on your quiz, but you did it, please get an email out or a text out to me like, hey, Dr. Garais, why you give me a 0? Because sometimes I don't see it. And I gotta, then I gotta go call like IT to go to reset your account, because again, medical language laboratory is a program just like any other program. Sometimes it's got a little glitches. So always pay attention to your grades. So with that being said, this is the moment where I stop the recording.